Hello friends. We all have wounds on our body. We try many treatments so that these scars do not leave scars or they heal faster. But many treatments that we know as right treatment are wrong, and let's learn their truth to avoid making known mistakes about wounds. Subscribe to the channel if you want a lot of information in a short time. 1. Do not clean wounds with oxygenated water and tincture diode. Substances such as alcohol and tincture diode used to clean the wound damage not only microbes, but also cells that are necessary for wound healing. In addition, the substances containing alcohol can irritate the wound area and cause allergic conditions. In wounds caused by falling or cutting, it is usually sufficient to wash with clean water and soap and cover with a clean cloth. The important thing is to remove external microbes from the wound. Patients with diabetes had to consult a doctor after the first intervention in this type of injury. 2. Itchy wound may be infected. There is a belief among the public that the wounds heal when it begins to itch. In fact, it is true that one of the symptoms of wound healing is itching. However, itching and discomfort at the wound may indicate drug allergy, irritation, and even the onset of infection. Therefore, the wound must be closely followed. In the event of increased redness, small blisters, burning or inflammatory-like formations on the wound edges, a doctor should be consulted immediately. 3. Leaving the wound open does not heal faster. It is not true that the wounds heal faster when left open. It is true that oxygen is required for wound healing, but a dry, humid environment is required for the wound to heal quickly. It is difficult to expect healing in a dried wound. The crust formed as a result of the drying of the wound actually delays the healing of the wound in the real sense. Although it is not a bad situation because it prevents the germ to catch, today there are dressing materials that allow the wound to breathe, keep it moist and protect it from microbes. To be done, after the wound is cleaned, a dirty wound is to dress with an antibiotic pomade and close it with a dressing and change the dressing daily. When burning, redness, pain, swelling is noticed, a doctor should be consulted. 4. Do not leave small wounds on their own. The notion that small wounds can heal on their own and no treatment is extremely wrong and dangerous. The wound is the integrity of the skin that protects the person from microbes. The microbes that enter the body from here can create infections that can cause much larger wounds. Especially people with conditions such as diabetes should care about even the slightest graze. After the wound has been thoroughly cleaned, it must be closed with at least one Band-Aid and checked for infection for the following week.